Welcome back. Now, life expectancy in South Africa has shrunk by 3 years in the past 2 years. That's according to Stats SA's mid-year population estimates. It says life expectancy is estimated at just over 59 years for men and between 64 and 65 years for women. This has been affected by the coronavirus pandemic. Diego Iturralde is the chief director responsible for demographics and population statistics at Stats SA, and he joins us now from Pretoria to unpack their findings. Thank you very much for your time here on All Angles. Now, your report indicates that life expectancy was increasing before 2021. So obviously this could be attributed to the COVID-19 pandemic.
Good afternoon, Maseko. Thank you for having me. Yes, indeed. I think the COVID pandemic has had a profound impact on the population dynamics of South Africa. And we have seen that for the year 2021, that the amount of deaths shot up to a level last previously seen in 2006 when we were in the midst of the HIV/AIDS epidemic. The good news is that the recovery from COVID-19 is beginning. And we have noted for the 21 to 22 year that the number of deaths has begun to decline, but is still far away from what we were seeing before the COVID-19 pandemic began.
And are your stats able to tell us what makes the female mortality disproportionately higher than the male mortality in our country?
Well, I think if we look at different age groups, we would see that mortality differs by age groups from one particular phase of the life cycle to the other. But if we're looking specifically around HIV and COVID-19, we have noticed that there certainly is a propensity for mortality to be slightly more favored in terms of females over males. Why this is the case, we can't really say. We would leave that to the epidemiologists to indicate why the two pandemics have hit females slightly higher than males. But if we take a global view, we can see that life expectancy for women is higher, which means that the age at which women are dying is not impacting the life expectancy as much as it is for men. We would see for men, for example, that in the ages around 40 to 50, there would be disproportionately more deaths amongst men in those age groups, whereas in other age groups, it would be the females that would be disproportionately higher.
All right, so it's not all doom and gloom, of course. There are some good findings, especially with the infant mortality rate, which has declined from an estimated 55.3 infant deaths per 1,000 live births in 2002 to 24.1 infant deaths per 1,000 last year.
Yes. This has probably been, from a health perspective, one of the main success stories that South Africa can tell. From the heights of the HIV epidemic in the early 2000s, we have seen a remarkable progress with regards to infant and under 5 mortality. And I think part of the good news is that COVID-19 has shown that there's a child-sparing effect. So a very small proportion of infants and children were impacted in terms of a fatal outcome with COVID-19, and that's resulted in there being a continuous improvement in under 5 and infant mortality.
So what do these findings then mean for our country? Maybe lessons that we could have learned during the pandemic, etc.?
I think that this report is really telling us, in terms of the pandemic, what the impact of it has been. That it has not been just a flu, as some may have suggested, but that the impacts are extremely profound. From a mortality perspective, I've already indicated that we hit slightly over 700,000 deaths in the 2020 to 21 cycle, and that can compare quite favorably with what we saw in 2005, 2006, when the HIV epidemic was at its strongest. From a fertility point of view, we cannot say yet with certainty that the COVID-19 has had an upward or a downward impact, and we would be waiting on the report on registered births, which our other colleagues at StatSA will be releasing later on in the year. But we've taken a conservative view that given the economic slowdown and other conditions that we have seen as a result of COVID, there is a possibility that fertility might drop in terms of the total fertility rate, but that does not necessarily mean that we'd be seeing fewer births, because of course there have been more women alive since then. And then from a migration point of view, we've seen a complete slowdown in terms of international migration over the past 2 years, which is now beginning to improve and to recover, but not yet at the levels that we've seen. So in terms of lessons, I think we can learn from this that a pandemic of the nature that such as what COVID-19 was can have profound impacts on our population over a short period of time, and we should be prepared to react to these shocks if and when such a shock should reoccur.
And of course, you also say in your report, you're proposing that policymakers should use a combination of measures to make more informed decisions for planning purposes. Can you just explain what you mean here in layman's terms?
Well, I think it would be a little bit short-sighted to look just at one indicator, let's say within the ambit of mortality, and to indicate that because life expectancy is improving, that we are on a particular trajectory. There are other indicators like the rate of natural increase, the crude death rate, etc. And I think that one other thing we should look at is at age-specific growth rates. If we have a look at the growth rates of several broad-based age groups, we can see that the elderly is the fastest growing population group in the country at the moment, those being over the age of 60. And I think it's reasonable to expect that in a future South Africa, maybe 15, 20 years from now, that the proportion of people who are elderly will be much bigger than what they are right now. So we should be in a position to begin to plan for that. We should ask ourselves the questions: what kind of health services and what kind of welfare services will be required for this particular age group at such a point in time? Right. So I think there are many indicators in this report. Many of them are interrelated, and that interrelatedness is what needs to be taken into account as we look to see what measures we should take to be able to cater for the needs of different parts of the population.
All right. Thank you very much for your time. That was Diego Iturralde, Chief Director responsible for demographic and population statistics at StatSA.